Hi, my name is Ghodasra. My topic is Invisalign effects of gingival health, and my PI is Dr. Cheever. So, just a brief introduction, gingival health is integral to periodontal health, as the gingiva provides both a physical and biological barrier that protects the tooth supporting structures. Inflammation of the gingiva is a primary response to bacterial biofilm accumulation, often driven by pathogens such as P. gingivalis, T. forsythia, and T. denticola. These pathogens release toxins that can compromise the gingiva, and if left untreated, may progress to periodontitis and tooth loss. Now, both fixed and removable orthodontic appliances have the potential to impact gingival health, and the debate surrounding aligners such as Invisalign centers on whether removability of these appliances improves or worsens gingival inflammation compared to fixed appliances. Unlike traditional braces, which are fixed and can make oral hygiene more challenging, Invisalign aligners are removable, theoretically offering better opportunities for plaque control. However, their wear time, potential for food accumulation, and the patient's adherence to hygiene recommendations may introduce new risks to gingival health. So, the objective, this literature review aims to explore the existing research on Invisalign and its influence on gingival health, focusing on both short-term and long-term outcomes. And by examining various clinical studies and patient reports, this review seeks to provide a comprehensive understanding of how Invisalign treatment may contribute to or mitigate gingival issues. This analysis will help to clarify whether Invisalign poses any unique risks or benefits to overall periodontal health compared to traditional orthodontic methods. So for this literature review, a systematic search was performed using databases such as PubMed, Medline, and Google Scholar to identify studies related to Invisalign and gingival health. Some of the keywords included Invisalign, clear aligners, gingival inflammation, periodontal health, and orthodontic treatment, and these were used to retrieve the relevant articles. The inclusion criteria were peer-reviewed articles focusing on the effects of Invisalign on gingival or periodontal health, and the studies were screened in two phases. First, by evaluating the titles and abstracts for relevance, and then second, by conducting a full text review to assess the quality and depth of each article. Data extraction involving documenting study design, sample size, intervention details, duration of treatment, and periodontal health outcomes. The collected data were then synthesized to provide insights into the effects of Invisalign treatment on gingival health, with attention to recurring findings and research gaps in the current literature. So for results, my first article was gingival health outcomes and patient satisfaction with Invisalign versus fixed appliances. And so this study underscores the significant differences in gingival health outcomes and patient experience between Invisalign and fixed ortho appliances. So over a 9-month clinical period, Invisalign patients demonstrated lower gingival and plaque indices compared to those treated with traditional braces, indicating reduced inflammation and bacterial accumulation. This finding highlights the periodontal advantage conferred by removable aligners, which facilitate easier plaque removal and less food entrapment. Moreover, the study emphasizes the enhanced patient-reported comfort and satisfaction with Invisalign, linked to decreased mucosal irritation and improved hygiene compliance. Collectively, these outcomes illustrate that aligner therapy not only maintains gingival health, but more effectively, but also positively influences patient adherence and motivation, which are critical components in ortho success. My next article was microbiological and clinical periodontal changes during early treatment phases. And so the clinical and microbiological evaluation by Livrini provides essential insights into the early periodontal responses within 3 months to Invisalign versus fixed ortho treatment. The study revealed that patients using aligners maintained lower levels of S. mutans and L. lactobacillus S, while fixed appliance wearers exhibited increased bacterial colonization associated with caries and gingivitis. Clinically, Invisalign users demonstrated significantly lower plaque and gingival indices. And then overall, it underscores and the role of aligners in minimizing the onset of gingival inflammation during the initial adaptation period. The next study was longitudinal microbiome stability and gingival health maintenance. The longitudinal comparative study by Shokeen provides an advanced understanding of how appliances types influence the oral microbiome and gingival parameters over time. Fixed orthodontic appliances were associated with a progressive rise in anaerobic bacteria and microbial diversity reduction, features linked to gingivitis and early periodontitis. Conversely, patients undergoing Invisalign treatment exhibited a more stable and diverse microbiome profile, reflective of periodontal homeostasis. Clinically, gingival bleeding and plaque accumulation were significantly lower in the aligner group, and the study's findings underline that the biological environment created by clear aligners fosters a microbial equilibrium and better periodontal outcomes. From an orthodontic perspective, these results highlight that appliance design, particularly the absence of fixed hardware, plays a pivotal role in maintaining periodontal stability during active tooth movements. All right, so my next article was comparative periodontal responses in prospective clinical observation. The prospective clinical study by Madariaga expands on the short-term and mid-term effects of different orthodontic modalities on gingival health. Over a 6-month treatment period, Invisalign users consistently exhibited lower gingival index and bleeding on probing, and than the fixed appliance users, despite similar oral hygiene instructions. Fixed appliance patients showed more pronounced inflammatory signs and plaque accumulation, likely due to the presence of arch wires and brackets that hinder effective cleaning. The authors concluded that the removable nature of Invisalign facilitates superior plaque control and minimizes inflammatory response. These findings align with broader clinical evidence supporting clear aligners as more periodontally compatible option, particularly valuable for patients with pre-existing gingival sensitivity or mild periodontal compromise. My next article was the influence of gingival phenotype on periodontal outcomes during orthodontic treatment. This longitudinal study by Alasiri brings a critical dimension to the discussion by linking gingival phenotype to periodontal outcomes in patients undergoing Invisalign or fixed orthodontic therapy. The research revealed that thin gingival biotypes were more susceptible to recession and attachment loss, especially under fixed appliances, while Invisalign users experienced more stable soft tissue profiles. Both groups demonstrated mild periodontal changes over the study duration, but the fixed appliance cohort exhibited more inflammation and gingival margin irregularities. This study emphasizes the importance of personalized appliance selection based on soft tissue biotype. From an orthodontic standpoint, aligner therapy may be especially advantageous for patients with delicate or thin gingival tissues, as it reduces mechanical trauma and bacterial biofilm retention that can exacerbate mucogingival stress. My next article was synthesis of systematic reviews on periodontal outcomes of clear aligners versus fixed appliances. And so this umbrella review conducted by DiSpirito integrates data from multiple systematic reviews to provide a high-level synthesis of current evidence. Across the included reviews, clear aligners consistently demonstrated superior short-term periodontal outcomes, including lower plaque and gingival indices and reduced probing depths. However, long-term studies revealed inconsistent data regarding attachment loss, with some suggesting differences between modalities diminish over extended treatment durations. The review also noted methodological variability among studies, including inconsistent hygiene protocols and varying treatment durations. Despite these limitations, the consensus supports the notion that aligner therapy provides better gingival health maintenance during active treatment. Orthodontically, this reinforces the value of aligners as a biologically favorable modality, though further longitudinal research is warranted to confirm the stability post-treatment. Now, my last article is a randomized clinical comparison of gingival and treatment outcomes. This was a randomized controlled trial by Liu, and it offered a robust clinical evidence comparing Invisalign and fixed braces over a 12-month treatment course. Both modalities achieved comparable alignment efficacy. However, Invisalign users maintained superior gingival health indices throughout the study. The fixed appliance group showed higher plaque retention and gingival inflammation, while the aligner group sustained better hygiene and comfort levels. The control design of the study strengthens causal interference, confirming that appliance removability directly influences the periodontal status. The findings affirm that clear aligners not only achieve desired orthodontic outcomes, but also preserve gingival health, a critical consideration in comprehensive treatment planning. This study encapsulates the growing consensus that Invisalign provides a periodontal advantage without compromising orthodontic efficiency. In conclusion, this systematic review highlights a pivotal role of orthodontic treatment design, particularly appliance type, in influencing gingival and periodontal health during orthodontic therapy. Across multiple clinical, microbiological, and systematic investigations, clear aligner systems such as Invisalign consistently demonstrated superior outcomes in maintaining gingival integrity, reducing plaque accumulation, and stabilizing oral microbiome when compared to fixed appliances. These findings emphasize that aligner therapy not only facilitates improved hygiene and patient comfort, but also offers distinct biological advantages for periodontal preservation through active tooth movement. The reviewed literature collectively reinforces the importance of individualized orthodontic planning that accounts for soft tissue phenotype, oral hygiene compatibility, and long-term periodontal stability. While short and midterm results are favorable for aligners, the evidence base remains heterogeneous regarding long-term attachment levels and post-treatment gingival health. Future research should therefore focus on extended longitudinal evaluations, standardized periodontal assessment criteria, and the exploration of adjunctive preventative strategies to optimize gingival outcomes across all orthodontic modalities. Thank you.